Hey, podcast listeners, whether you're a healthcare executive, frontline clinician, digital health entrepreneur, or simply someone trying to make sense of your own healthcare journey, the other side of the chart is for you. I'm Dr. Jill Goldenberg, a physician and a leader in clinical informatics, quality, and value based care. I have spent my career at the intersection of people, process, and technology, building systems to improve healthcare delivery and patient experience. Join us for the other side of the chart, where we have candid conversations with patients, clinicians, leaders, and system innovators, where together we will reimagine a healthcare system that works better for everyone on both sides of the chart. Coming up in our premiere episode, we're starting where healthcare actually begins, with the patient. Dalia, a lawyer, a mom, and a cancer patient many times over, shares what it's like to live on the receiving end of the system as it exists today.
And the first thing she did was hug me
Hmm.
before anything. And she hugged me. She's like, hug me this way so you can feel my heartbeat. And I was like, and I just melted
Sure.
and started crying. And she's like, you just realize and are acknowledging that you've had cancer. Because a lot of times when you're going in treatment, you go into fighter mode, you don't think about it. This was after I was finished chemo.
Yeah.
And that's when oftentimes people start dealing with the emotional side of what they've gone through. Um, and then she sat me down and she's like, I think we need to stop the hormonal treatments. And I was just like, but you said, and this is really important, and I really want to live, and this and that. And she goes, you're a very analytical person, Dalia. I'm going to take your pathology report and walk through the presentation I do for my medical students. And we're going to walk through like you're a case study so you can see. And she took 40 minutes, which is unheard of for busy doctors. And that's not a dig on doctors, that's just the nature of our medical system,
Sure.
and showed me her PowerPoint presentation with my pathology report next to it and walked me through why this was an okay decision.
Mhm.
And it was just it showed me how medical treatment is as much an art as it is science. And she really treated me as a human being.
As you just heard from that short clip, Dalia's story is powerful. It's deeply human, and it is a must listen for anyone designing healthcare systems, process, or technology. Dalia's perspective as a super user of healthcare, and not just in crisis, but across years and systems, is exactly what we need to design better. Then, in episode 2, we flip to the other side of the chart to a physician, a national leader in clinical innovation and health policy, Dr. Kevin Larson. Together, we will explore the evolving role of medical documentation, its original purpose, its many modern audiences, and the future of transparent, patient centered documentation. We talk about how notes can either tell a meaningful story or obscure it entirely.
So I think Open Notes is part of a whole movement to better put patients at the center of what we do. I remember a quote from the IHI, Don Berwick, that was from the patient's voice, nothing about me without me. And so how do we live out this partnership with patients,
Mhm,
which patients want? They
mhm.
really want that partnership. They want that self-control. And we've moved in general in American healthcare, from I'm telling my patients what to do to being a consultant with them and eliciting values, goals, preferences, talking through options and helping give expert advice in a consultative way. So that's really shifted the whole culture of how healthcare gets delivered. And in that partnership model, a lot of patients want to be able to really understand deeply what it is their conditions are. And I think also with the availability of information on the internet, this idea that I need to give patients just some simple terms no longer is necessary. They want the complicated medical terms so they can go Google it themselves and say, hey, what is this complicated thing that my doctor told me? And they can actually find that information on their own.
The Other Side of the Chart explores what happens when we truly listen to the people inside the system. If you're a healthcare leader in technology, operations, or policy, or if you've ever found yourself lost as a patient in a complex system, this show is for you. Subscribe now to The Other Side of the Chart, stories and insights for those building the future of healthcare from the inside out. The Other Side of the Chart is a production of G-Berg Productions, produced, hosted, and sound editing by Dr. Jill Goldenberg. Music by Relaxing Motivational Corporate by Fretbound. From Free Music Archive, licensed under Creative Commons Attribution 4.0.